Hi, Rachel. Welcome to the show.
Thank you. Thank you for having me. It's an honor.
Yeah, it's really great having you on here because I'm really interested in. I read a bit about your journey because I read a little bit about your book that's out, and I just wondered if you could tell the listeners a bit about how you got into the health business, so to speak, and tell them a little bit about your own health journey.
Sure. Well, I'll give you kind of the Cliff Notes version
Yeah.
because it's quite a journey. Um,
Mm,
but God always uses it for help for other people. So I guess fortunately, unfortunately, I became ill at a very young age. And that's slowly what started my discovery into alternative health. Now, I grew up in a very small town and we didn't necessarily have access to information or other things or know of other things. So when I was about 19, I started fainting and I started having issues with my health around that time. And after going through a myriads and myriads of tests with the Western medicine route and not
mm,
really getting any answers and getting sicker and sicker and sicker and more symptoms over the years, I finally, and with my parents' help at that point, because I had to move back home, we started looking into other alternative answers. And mostly because, I wasn't being heard, I wasn't being listened to, but also we just weren't getting even any answers as to what was going on.
mm,
So after about a year or so, we started looking into alternative health, and we fortunately had a naturopath in our area who suggested, I might have something, and so we got that tested, and sure enough, that's what I had. And then that kind of led me into the journey of alternative health in that scenario. And, he helped me to the best extent of what he could, but I wasn't really improving much with his care either. So,
mm.
I started seeking out other things in my area. We traveled a lot to other places to try to get different types of treatment. And then, I finally decided after getting maybe about 30% better that I needed to go back to school and I needed to figure out some stuff because I had kind of maxed out what I knew.
Yeah.
So at that point, I went to school, still very ill, but God pulled me through, and I actually did really well. And then when I got to grad school, when I got to chiropractic school, which is what I'm licensed in, um, I started getting knowledge and just exploring other facets of alternative health. And so I don't really have like a typical, chiropractic story in the sense of I had an adjustment that has changed my life.
Yeah.
It was more just the openness of thinking of these types of practitioners that really interested me in the profession. And I was honestly, first of all, interested in nutrition because that's what had gotten me into alternative health. Um, and so while I was in school, I met some amazing mentors, I met some amazing people who then opened my mind to the world of craniopathy care
Yeah.
and healing the brain and opening the brain. And then I got introduced to more people over the years who introduced me to different facets of nutrition. And then, the emotional brain and healing all of the traumas with that in my life. And so, over the years, I kind of just cultivated a practice into all of the different facets of healing.
Yeah.
And partly it was my full journey of complete health, but also through, thousands of patients now and just years of experience. It's this part of why I wrote this book is because there's only so much I can do. And
Mm,
I wanted to have a blueprint that people can utilize of really how the body really works, and then alternative holistic methods to help someone either be their own doctor and have those resources to know what's going on, or to seek care of other people that they may not know these types of services are available to them, so
yeah.
that they can use it for a guide. And ultimately, there's a lot in the book that I talk about just about things in our medical system that are not right. They're corrupt. And there's reasons
Mm,
people are just strung along and they're not getting answers. So it's very eye-opening. I mean, it's a it's a long, hefty book, but it's meant to be a guide for people to begin to explore all of the ways that someone can achieve, full, vibrant health.
Yeah, because that's one thing that I read in your book, which I really liked. I'm just going to read it out. It said, you have one vehicle called your body for the rest of your life. So it needs continual tuning into and care to keep it running. And I just really like that. I think that's a really good, just something to really sort of almost meditate on for a while for people to really think about,
Yeah, well, I mean, especially when you're young, my case is unfortunately fortunate that way, where I was forced to at a young age really take knowledge and learn about health. But I'd say a vast majority of people, they don't really worry about their health until it starts to deteriorate, and then they're really searching for health outcomes. And not that that's not, I guess, the right way, but it's not really the best way to do it. Because you don't want to work your whole life and then use all that money you worked for to try to heal your body.
Yeah.
It's to enjoy a vibrant life, and it's available to us. There's just points where you do really need to educate yourself on not everything of how it works, but how it works for you, because we're all unique. And you want to feel good in what you're doing and not just getting by day to day.
Yeah, it's like you want to flourish. You want a flourishing body that flourishes, not just survives.
Totally. Yeah, not just getting through the day to day. You want to be able to feel energy. You want to not crash at the end of the day. You want to be present and there for the people that you serve and for your kids and for your family. And it's hard to do that when you feel awful and, you're not really getting answers to what you're doing. But a big part of health is, majorly lifestyle, and it's taking control of that and feeling empowered that way. And knowing, okay, I have the information now to do it, but also nobody can do it for me. I have to do that and do it that way.
Yeah. What I was really interested in is you mentioned the three phases, and you talk about mechanical roots, chemical roots, and spiritual or emotional roots. I'd really like to talk about each one a bit. So, and to start off with, what are mechanical roots?
Yeah, so let me preface it this way, because I think this will help people understand. When we look at health in general as a whole, complete, vibrant system, how I explain it to my patients is that health is broken up into three different categories, or phases, as I call them in my book. So the first phase of what we need to be in balance, and these three phases really need to be in balance with one another for us to achieve overall health and vitality. So the first phase that needs to be in balance is the mechanics of your body. So that's how things move in your body. That's how things flow in your body. That's how, your brain and all of your nerves, which control every single function of your body, that's how they communicate. So if there's something impacting your communication of your brain to the rest of your body, then there's obviously going to be some disorganization of overall health-wise how your body is functioning. What I tell people in that phase is your brain only cares about survival. It only cares about keeping you alive, your heart beating, your lungs pumping with air. And so if there are things that are impeding the way that your brain and nervous system can signal and can function, it's always going to go back to survival techniques. So you can do all of these things in the world, as far as take the most expensive supplements and do the most amazing therapy lessons. But if your brain is only operating with survival, and it's constantly just in survival mode because that's the environment that it has to work with, it does not have the adequate energy to delineate to some of these other phases that I'll talk about. And this is why I always start with this first phase, because we think of
Right.
energy bank.
Yeah.
If it doesn't have, the brain is, its environment is the cranium or the skull bones. That's where it lives. And then
Mm.
your spinal cord, lives down your spine and then goes into your, your other joints of your body. And so I always start looking at where the environment of the brain is. That's what, makes me a little bit different as to where your brain lives. That's its home. So if there's pressure or pulling or tension and movement restrictions in those areas, anywhere along that connection route, then your brain is going to prioritize what's the highest thing it needs to do, and other things are going to begin to fall away. So that could be your hormones or your sleep or your mood or your stress levels or anything like that. So by freeing up the environment and balancing it, which is what I talk about really predominantly in that first phase, is we free up energy for your body to then go back into the self-healing mechanism that it is designed to be. It's designed to self-heal. It's designed to regulate itself. But it cannot do that in a toxic environment or an environment that doesn't allow it to move. So that phase is really about all of the things structurally that can inhibit the mechanical function of our body. So I talk a lot about the way that we breathe. I talk about, someone that's had traumas to their body. Trauma is a huge thing to your nervous system, whether it's concussions or head traumas or even birth trauma. Is, how we start into the world determines how our nervous system is functioning. Because that's the biggest stage of development that we experience, is during the first 2 years of life.
Yeah, right.
Yeah, that's how we our nervous system gets designed and regulated during those years.
Okay.
Any trauma to those areas, if we go back, then we can actually delineate how someone kind of grew and how their nervous system developed. And there's many areas within that, trauma thing that can influence our brain and can influence our body. Yeah. And additionally, when we look at movement, we also look at the flow of things. So I talked a little bit about the flow of how our brain and nerves connect with our body, but there's also a lot of fluids in our body that need to flow. So our blood, it needs to flow from our brain to the rest of our body and our muscles and our organs to give us oxygen and nutrients that we need to function. Specifically, I talk a lot about the brain in my book, but we need movement of blood flow to get things around. And the second important fluid balance is called your spinal fluid, which also goes into something called your lymphatic fluid. And you can think of that like your plumbing system of your body. And that also is pressure regulated by how our body moves. So if we have restriction from the bones of our head to our feet and movement, then that's also going to affect how we get nutrition to our body, how we get out things in our body. Because, it can't move, it can't drain. And so that's kind of the first phase of what I talk about in my book, is making sure we create an environment, we create flow, we create drainage for things to work, and we free up energy for your body to focus on other areas.
Yeah, and you're talking about blood flow, and that blood flow is important for healing too, isn't it? Because I was suffering from tendonitis, and I heard that, blood flow is really important in that area for healing.
Flow is important for anything. So when people have scar tissue that builds up from trauma, then there's a lack and a stagnation of fluid. And if you think about, I tell people the scenario too, if you think about a pond, it's very stagnant. And then what happens in a pond is you get scum and you get mosquitoes and you get all this nasty stuff that happens in ponds. It's a cesspool. And that can happen through different areas of your body. I talk about it happening in the brain, and then the brain gets foggy because nothing can drain. But that can happen anywhere. Anywhere there's stagnation of fluid, it becomes like a stagnant pond. And then all of the unwanted guests then come to that pond because they like it. We need a flowing system in our body. We need stuff to flow. We need it to bring life. We need it to flow things in and out. And so fluid movement and balance is really important.
Yeah. And then you talk about the chemical part, which you can go into a bit more of that.
Yeah. So once we've, worked a bit on the nervous system and the mechanics of the body, then the second tier of health in general of the 3 phases is balancing the biochemistry of the body. So that has a lot of different facets to it because we're all uniquely different. But that, in a sense, for health is more of the foundational things of what we need to heal, what we need to function, energy, fuel that we need to function day to day, how we sleep, how we regulate our mood, our hormones. So that all relies on food that we consume.
Yeah.
How well we break our food down into energy. Things that are affecting how our chemistry is working. And that's a huge, probably one of the biggest sections in my book is toxins.
Yeah.
You cannot avoid it. Our world is extremely toxic and getting more toxic.
Mm.
It's not surprising that people, are sicker. I think like autoimmune is like 1 in 3 people now. So it's very, very rampant. And it's our body screaming that there's things in us that are not supposed to be there. And so there's a lot of toxicity that happens that affects how our biochemistry actually works. And so, I talk firstly about, in that section, I talk first about just basic nutrients that we need to function. So, there's lots of myths around foods. So I kind of demystify some of those myths, specifically for your brain and for your nervous system, what they really need to function. There was this whole fad for a long time about like low fat diets and all of this stuff, and it just completely destroyed people's health. So I kind of go over that. I go over how there's been change agriculturally to our foods. It wasn't really until industrialized things came into play and farming that we then utilized a lot of grains, a lot of corn, things of that nature, which now it's like everywhere, everything has those items in it.
Yeah.
I talk, kind of about how that started and how our diet over the years has changed and how that's affected our genetics and the way that we now function. And so I talk about, we need really good fats. We don't really need much of the grains. And the things that are really inflaming our body as far as food goes. And then I give a list of superfoods and things to help supercharge our body and begin to get it to function. So that's kind of the first section. And then I go really into all of the ways of toxicity that can then affect, because food is very important, right? Good, healthy, clean food. Unfortunately, our foods our soils are now super deficient in nutrition. So even super healthy food, we're still not necessarily getting all of the nutrients we need. And additionally, all the toxins in our environment are stripping us of those things too. It's important for us to know all of the ways that can affect how our chemistry works. So I go into all of the toxins and all of those things, from radiation to, foods to chemicals, pesticides, birth control, all of those things. And then I also go into other things that affect your biochemistry, as far as I call them stealth pathogens. So things like parasites and bacteria and mold is a big one. things that are really stealth and they hide in our body and they don't test well in labs. And, you know, because that was kind of my initial integration into alternative health was through these stealth pathogens. And so I have quite a bit of knowledge on those as well, as far as how those influence our body and how those affect the way our biochemistry works. And so I have a big section there, and I have a couple people that helped me write those sections as far as, you know, explaining it well.
Yeah.
How to determine them. And then the last part of that section is going through then how each of us are uniquely designed. So, yeah. You know, the world of genetics now has become the past, I want to say 10 years, more and more on the forefront of medicine. And I like to say this about genetics, that we all have certain genetic variations that we're born with because of those things I've mentioned.
Yeah.
Toxins and all that stuff. It's it can be a huge part of the picture for some when we're looking at toxicities and infections, because we're finding out what that person uniquely needs to help them detoxify, to help them create energy. And so I wrote that section in the book because a lot of people do gut protocols and detox protocols and infection protocols, and they either don't get better or they get worse.
Yeah.
And so in those cases, we look into the genetics of that person and we find kind of the roadblocks of what can be keeping them from ultimately healing. And that's what I customize with my nutrition patients, is customize it based on that. And usually it's way more successful for them and easier. And so there's a section there too where it helps, because there's some really good genetic teachers out there. I think, what's his name? Dirty Genes guy. He wrote the book Dirty Genes. He does an excellent job of explaining genes, but it's still like a lot of information for the average person.
Yeah.
So I had to also help, you know, qualify that so people can understand, okay, you know, what does that mean? I still don't know what that means for me. So there's a big section there to help guide people if they do, you know, end up getting some of their genetics tested and they want to know what that really means for them, and also how to put that into their daily routine of what to do. That's in there too. So that kind of qualifies. There's some other layers in there that I talk about the age of digitization now and what's that has done to our body. How with ADHD, we now have terms like digital dementia, where our digitized world is causing dementia. So, you know, there's other topics within there that can also affect a lot of our biochemistry, but more or less that section is devoted to what is the foundation of what we need? What are we putting in our body that we need to be aware of? And what do we need to be more, you know, careful of? And then demystifying some foods that are more optimal for our development and health.
Yeah, I mean, some of these tests, I don't know about the USA, but in the UK, there's only certain tests that you can get through the conventional medicine route. And what we have what's called the National Health Service, which is a free service for everyone. And they offer certain tests, but if you want other tests, you might have to go to like a functional, functional, I can't remember their names. What are they called again?
Functional medicine doctors.
Yeah, functional medicine practitioners and people like that. And they will they know people that sort of do these tests, but the conventional medicine do certain tests and they will come out with, no, you're okay, we can't find anything wrong. And from what I found from when I've spoken to people, I've had family members who've had to have certain tests as well. And like the conventional medicine, they can't find anything wrong, but they've still got the symptoms. Yeah. So they have to go down the alternative route and sort of even like do their own research in finding these people in the first place to see, because just the usual, your what would we call the general practitioner, your GP, they will obviously only refer you to conventional medical tests and stuff, and they don't always even find find out what's wrong. And some of them, I think, can't detect it earlier. I find that maybe some alternative practices can detect things earlier than conventional routes as well.
Yeah, so I mean, I can't even tell you how many times I've heard, your labs look great, but they
Mm.
can't get out of bed, So there's a limitation there. You have to know, I don't know much about European medical school, but in the American medical school, in their whole entire training, they're taught maybe a couple hours of nutrition. So it's such a broken system. They're, mainly focused just on medications.
Yeah.
And for emergency medicine, yes, but for the average person, most of this is lifestyle stuff. And so most of them have zero training. And even if you do have a lab out of value, they're going to give you a medication for it because that's all that they're trained.
Yeah.
Unless they're the functional medicine practitioners that have said, no, I think that there's more to this, and I want to do more schooling and more research and really find the root causes of what's going on here. So yes, labs are tricky. There are some really wonderful labs that do a better job at determining some root things, but you have to be very specific in what you test. So if I suspect Lyme or mold or something else, I have to test very specifically for that lab. And even then, sometimes they can miss it. So labs are great. They're a great tool that we have, but they're not the gold standard for everything. So we have to know that, and we have to also listen to our patients and what they're experiencing. They're real human people. We can't be so focused on just a lab that we also miss what they're experiencing and what they're saying. A lot of times you can get a really good idea of what's happening just in their history. So it totally depends on the practitioners. There's some really good functional medicine doctors out there. There's some that wrote some stuff in my book as well, medical doctors. And, they've really gone the part, but the average doctor, you have to know the whole medical system is set up for meds. And so that's all that they learn. That's all that they know. If you want more help to actually heal, you're going to have to look elsewhere.
Yeah. It is similar here. Medical students don't get much about nutrition at all. And I mean, I listened to a podcast by two different podcasts I listened to from two different doctors in this country. And I think one of them has actually lifestyle medicine courses for doctors and nurses and medical professionals to come and learn a bit more. And another one, I think he's done some sort of nutrition for medical staff, that kind of course that they've decided because of experiences that they had. One, I think, had an experience where his son got very ill. And another one had an experience of his own when he was very young, in his early 20s, just a junior doctor. And he had atrial fibrillation. And he was due to have a procedure, but in the meantime, he decided to change his lifestyle, and he ended up not needing this medical procedure because of it. And he's really gone down the nutrition route and lifestyle route. And he's just designed courses himself that he likes to then teach doctors, and even teaching doctors how to cook and just how to cook healthily. And he's just got his whole stuff now is all about nutrition and lifestyle. So there's that going on. And I think, yeah, in medical school itself, it's I think similar to the USA, I think the UK is probably, sort of under the thumb of big pharma, basically.
Yeah, medical school is basically just big pharma school.
Yeah.
And we commend those doctors. I mean, they do a ton of school, and a lot of them are misled getting into what it really is. They want to help people, and then they get in and they find out, oh, this is not what I thought it was going to be. Unless you're just, doing surgery or surgeon or something like that. Emergency medicine is very vital. But, we commend them because, going out and then, doing their own private practice, which is what they have to do, because they can't function this way in a hospital setting. They have 60 seconds with people, and you can't really figure out anything in 60 seconds. Sorry. It's kind of impossible. So, they're really confined to what they can do, even if they have an interest in it. So we commend those doctors for what they've done. And, for us, like other types of practitioners, we had to rise up and we had to take some of the jobs of that for a long time because the needs
Yeah.
were being met in people. And so, we get a lot of heat for that, but it's not about us, it's about what people need. And our foundation of our degree is more open-minded to all the different ways that your body can heal. And if we can work together with other practitioners, then ultimately it works best for people.
Yeah, yeah. And I know that here it can sometimes vary from doctor to doctor. You might, like my mum said, one of the doctors she used to go and see, like the general practitioner, it's like the person sitting there with the prescription pad in their hand, almost ready to just write something out. Whereas you might see another general practitioner and they're just the last thing they want to is to prescribe something. They'll sort of question you and look at other ways if they can, and sort of suggest alternatives if they can, that as much as they know.
Yes. Yeah, it's tough, you have to go kind of outside of the main medical, I guess, hospital setting to find those good people, but they're there. And the blessing of the past couple of years is we've found more of them, and more of them
Yeah.
are standing up, and so we're thankful for that, because we need more medical doctors standing up so that system can begin to be taken apart.
Yeah. And I wanted you to just tell us a bit about the emotional and spiritual phase, that as you refer to it, and what that involves.
Yeah, so the third phase of health, overall health, which is what we started with, is the emotional or spiritual layer. And so, the reason that I focus on, not that this is last because it's any less important, if anything, it's really important. But oftentimes what I found with people is when they're in a ton of pain, when they don't have what they need foundationally, a lot of the emotional work that can be done doesn't necessarily stick, or, it doesn't like dig into what they need it to do. And so sometimes it does for some people, but what I found over time is once we start changing the biochemistry of someone and they have what they need now to make those changes, and their nervous system is more balanced, they're not constantly in fight or flight all of the time. They have now the energy that I talked about initially, and now the foundation to make some of those changes. Stay, because when you think about that energy bank again, going back, it takes the most energy out of anything to create a new pattern in our brain. So we talk about it all the time, like we got to create a new pattern, we got to do this, we got to create a new pattern. But if you don't have energy deposited in your bank account of your body, then it's going to be very difficult for you to actually create a new pattern. And that's how so many people fall off and they're not successful, because they really don't have what they need to be successful. So if we can deposit a lot into that, then your brain can actually say, okay, I'm ready. And you'll hear that with people, like, I just wasn't ready to make that change, but now I'm ready, or however they want to word it. And something shifts, and I see that a lot in my practice, where I'll say stuff in the beginning, but they don't really understand it until we've done some work. And then they're like, okay, yeah, now I'm really open to that. And I think that that's really going to help me. And so that's why I preface it at the end. It's not that it's any less important. It's very important. But oftentimes it's not as successful for people unless they do some of those other things. So that's why I wanted to mention that first. But the emotional brain is very powerful. There's lots of different facets to your emotional brain. And, your thoughts in the sense of health, there's also many facets that can limit your healing. So for instance, you can have limiting beliefs, you can have agreements you've made in your past, you can have vows you set against yourself. There can be even things in your family line that have trickled down.
Yeah.
Now you're holding those things, and they're literally blocking your health. And so you could be doing all of the right things. I see this oftentimes, I'm very blessed living in an area where people are more holistically minded. And so sometimes people will come to me and they've done all of these things, eating the right way, doing these things, but I can't lose the weight, but I can't do this. And and then we have to go back to mindset, because there's so many things that either have been programmed that they don't even know have been programmed. And then, their emotional brain is not there for health either. So sometimes we have to go back and we have to figure out what kind of those blocks and levels are to healing. Are they things that we've been raised with that we don't even know are really improper? That's just how we were raised. Or like I mentioned, generationally, you see things run in family, like heart disease runs in my family, heart attacks run in my family, blah, blah, blah runs in my family, anxiety runs in my family. Those are really serious bondages for people. And they prevent them from health, and they prevent them from healing, because you take then on that mantle and you say, oh, this is part of me. It runs in me. It runs in my family. And then you block your healing. So that's just a small example of what I go through, but there's also many layers to that, where people either something that they've blocked or their family's blocked that also needs to be released from them. One of, I think, the biggest things that I'll just mention in this chapter in regards to health is I titled it Dismantling the Diagnosis Culture. And that is in the medical field where we diagnose everything.
Yeah.
And we say, oh, you have this. Oh, you have arthritis. Oh, you have autoimmune. Oh, you have this. Let me diagnose you. And diagnosis is pretty much for the sole purpose of insurance. You have to know that. So they have to have a proper diagnosis to get insurance money, right? Additionally, a proper diagnosis will allow you to have a more successful treatment.
Yeah.
Dangers with the label of a diagnosis. There's so many dangers with that. So what I try to tell people is, okay, you had this previous diagnosis of, whatever it is. You're expressing some symptoms in relation to this, but I don't want you to take on that you have this. Okay. So, we're writing down things for the sake of writing down things in the medical report system.
Yeah.
But I don't want you to hold this as something that's a part of you again, because then it's going to consume your whole thing. And that's what happened to me for many years when I got diagnosed with Lyme disease, that I attributed every single symptom that I had to Lyme disease.
Yeah.
Say, oh, it's Lyme. It must be this. It must be that. And granted, there were a lot of things that were that, and I wasn't getting properly treated for them, But additionally, we can be so consumed with that, or, I have anxiety, or so consumed with that we actually begin to miss true parts of what we need for healing.
Yeah.
We don't really get free from that because we've actually taken it on as part of who we are. So, I spend quite a bit of time in that section just going over some of those things and helping people to forgive doctors, to forgive them if they didn't listen to them, or people in your family, if you didn't listen to them, if you didn't hear them, what they were going through, you need to forgive those people. You need to forgive what was spoken over you. If it was like a cancer diagnosis or whatever, you need to forgive them, and then you need to clear that label off of your life.
Yeah.
You that to be a part of your health and your emotional brain. And that can go with stuff, even with different racial things of that nature too, where there's medical stuff that happens that's very racist in different generations. And so, that needs to be forgiven and dealt with in order for these communities to actually begin to heal and have access to that type of healthcare. And then, the last section is just tips I give to help then once you've kind of weeded out all that stuff.
Yeah.
The first part is like just really weeding out. And then the very last section of the emotional healing part is then beginning to fill up the things that can help you then begin to expand your emotional brain and expand your knowledge. But you can't really expand it until you weed out all of the toxicity stuff that's in there of stinking thinking.
Yeah.
And then, I give some tips in there to help people expand that, get into a creativity again, and things of that nature.
Yeah, it's good. And I think people can sometimes, even when it might not have done the physical stuff that needs to be done, they can still start off with some sort of emotional and mind stuff, just maybe sort of doing more just relaxation and stress reduction and
Sure.
meditation and things like that. I think possibly can be done even whilst there's maybe at the beginning of dealing with the other stuff.
Yeah, absolutely. I would more categorize that into maybe the first stage of helping the nervous system, right? Because that's more of our goal. Like we're using a mental way to do that, but our goal is really more to balance the nervous system.
Yeah.
So I would say that falls into that category. My thing is that can work wonderful for some people. Other people, they sit there and they can't shut off their brain.
Yeah.
And their nervous system is so much in hypersympathetic dominance that it needs a reset first. And so when I can get in there and I can open stuff up and I can balance their nervous system, then they can go into that session and then they can be like, oh yeah, it was way easier for me to do that because we just reset their nervous system.
Yeah.
So I would categorize that, I think, more into like a nervous system reset of what you're doing with that, which I think is absolutely super important to do. Breathing is another huge one, that is also meant to regulate your nervous system. We have to have movement in order to breathe. So they always go hand in hand with one another.
Yeah. Okay. No, this is really good. It's really good stuff. Just putting it in like the 3 phases, I think it's really good just to explain what the parts that they are, the mechanical, the chemical, and then the emotional. Because I think now we're seeing more and more people recognizing the emotional part in health, which I think wasn't recognized even maybe like 5-10 years ago.
Yeah, we've seen it just explode. And even like mindset stuff now is just, there's so many mindset coaches and, it's just exploded, which is amazing. People are finding out the power of their thoughts and the power that they have to actually change stuff. For some of my real chronic patients in that section, there's techniques that are very helpful. One's called DNRS. Another is the Gupta program, and they're programs that also are mostly like mindset changing that can change someone's health. So, I don't personally do that. Like I help people through that because I've taken some of those things. I don't have time to do that all, but they have courses where it's literally retraining your brain and your thoughts. And again, super powerful, but you want to have the energy to be able to do that because retraining is a lot of energy output. But that is super, super important for people because again, they could not heal because their brain is trained to work that way. And I think that's why we're seeing such a huge explosion in mindset is because people are recognizing that, hey, I don't really have to live this way, or no matter what I feel, I'm still not going to believe. I'm going to have hope. And, so it's wonderful to see that. I think it's great that we've seen such an explosion with that. And that's why so many people are getting healthier that way.
Yeah, it's really great. So Rachel, thank you for coming on my show today. I was really interested in finding more about these phases that you talk about, and I learned a lot, I think. So I hope our listeners did too.
Yes, it's my pleasure. Thank you so much for having me. It's what I tell people is it's kind of 3 books in one. So that's why it's rather on the large side, but it's meant to be a guide. So it's not, like you have to understand it all at once. There's probably some things you won't understand at first, but it's meant for you to have a resource and to go back. If you need help in more section in one of those phases more, then you can go back and work on those things. And that was more or less my goal for getting this out there.
Yeah. And you do quite a bit on the social media, don't you? Like, I mean, I follow you on Instagram. You kind of put out little videos and things I've noticed on there. And you yeah.
It's a love-hate. It's fun, but I really don't like being on my phone very much. But that's the highways of communication. We wouldn't be able to do this now. So it's a great way. We just have to have healthy boundaries. So yes, I am on social media. My Instagram is Dr. Rachel. I'm on TikTok and on Facebook, although I'm not on Facebook very much. I have a podcast as well called the Unfiltered Healing Podcast. That's also on YouTube, Apple, and Spotify. Blog and lots of other stuff on my website. So
yeah, we'll be putting all those in the notes anyway, all the links. So
perfect.
Yeah, can look at that later. Okay, thank you very much for coming on.
Thank you so much for having me. I really enjoyed it.
Thanks for listening to this episode of Wellbeing in the Kingdom. If you've enjoyed, learned from, or been inspired or empowered by today's episode, then please help to support the show by leaving a 5-star review wherever you get your podcasts.